With the passing of the Affordable Care Act, everyone in the United States can start getting health care. But Massachusetts was leading the rest of the country when then-Governor Romney signed a similar law into place just a few years ago. Here to explain the differences and to talk about how the two bills will have to work with each other and what national health care will mean to other states like Connecticut, Vermont, and New Hampshire, we have Professor Pat Carley from American International College. You teach a course called Health Policy and Administration, so this should be an easy topic for you to help us understand. Talk about, before we even get into the different healthcare and how it'll affect different people in different states, talk about the history behind healthcare. Where did it come from?
Well, when you look back in the early 1900s, there was a lot of hospitals that were up and running, and people didn't go to the hospital unless they were dying. So there's a lot of beds that were hanging around, but there were still people that needed healthcare services. So back in Texas, around Baylor University or Baylor Hospital, they started a kind of like the very first health insurance, where they offered it to teachers, and they said for $6 a month you can come in and use all these services. What happened next was then they would move to another town, and that hospital didn't have the same service, and then that hospital started learning about that and became a broader kind of application throughout the nation in the birth of Blue Cross. And then physicians realized that that same services could be offered on an insurance basis, and that became Blue Shield. So that really started doing well up until the end of World War II. And what happened was there was a massive insurge of industry that needed workers, and there wasn't that many workers. So a lot of businesses were fighting over trying to get workers. The government was really concerned about inflation getting out of control. So they limited the amount of wages that people could be advanced each year. So to get them to offer some kind of enticement to work for this place or that place, what they did was the law actually allowed them to offer benefits within a certain range. So healthcare benefits were a huge attraction for the competition of workers. So all of a sudden that became the norm, as it is today.
Except now, where it's going from the employers offering the health insurance to the government will be offering the health insurance. Is that correct?
Well, almost, because what happens is in that interim of after World War II, where everybody was getting it through work, it became the norm. But if you start to look at it, everybody who was working had health insurance. But there was a big group that were not getting health insurance, and that was the elderly and children or the poor. So another guy from Texas, President Johnson, Lyndon B. Johnson, another Texas guy, came to the rescue and started Medicare and Medicaid back in 1963, the mid-60s. So everything was kind of moving along fine until we had a lot of these recessions that started coming up, and people were realizing that when they got laid off, they were getting hit twice. They were losing their income, but they were also losing their health insurance. And this recent one kind of brought everything to a head. And we had to look at other countries, and we had to learn a little bit about what they're doing. And they found out that they weren't employer-based. So the big effort is to get away from employer-based so that people can have their opportunities to actually say, well, I want this health insurance or that kind of health insurance. So that's the effort with the Affordable Care Act.
So
hopefully.
Now that it is officially passed, what will this mean? Yeah. We'll get to Massachusetts, but let's go with the other states. We have viewers in Connecticut, New Hampshire, Vermont. What will this mean for them?
Well, if you think about it, there was a case up in Vermont and New Hampshire. And back when there was a lot of companies that were moving out, and there was a progression of maybe some of the jobs going to China or other places in the country, maybe to the south of the country. So a lot of people in New Hampshire and Vermont started to go on, let's say, disability. And then New Hampshire actually started to create a lot of restrictions on that disability. And they would limit the time, the amount of money. A lot of people started to move over to Vermont. And so that put a big strain on Vermont now. So this is what they call moral hazard. So one group suddenly is disadvantaged when they normally wouldn't have been. So in this case, what happens is people, the different states now, Massachusetts, Connecticut, or Vermont, New Hampshire, when we start to look at it, that potential for moral hazard is removed. because now it's national. Everybody will have health insurance, not just people in Massachusetts. So that's something to keep in mind when we start to balance this whole thing off.
Okay, and those residents will be able to go to what's called the marketplace and almost like a one-stop shop and buy
Right.
their
Like
coverage?
Yes, exactly, because in Massachusetts we have the Commonwealth connector, but now they'll have their own individual state connectors. If the state opts not to do that, then they have the federal version of that. They can get it through the federal connector, so to
Okay.
speak. Yeah.
Now talk about Mass residents. We've had statewide health insurance available to us for the past couple of years. Will anything change? Do they interact or negatively impact each other? How is this going to happen?
No, actually, the two meld well together. And it's interesting that Governor Romney was a part and parcel to this whole thing, and now the country is somewhat adopting it. Some states are adopting it earlier, some with open arms, some are kicking and screaming along the way. But in essence, everybody's moving in that direction. So for us, if we don't have health insurance, we get penalized by our state tax. Now you'll be penalized if you don't have it on federal taxes.
And why would somebody not get health insurance from the marketplace? I've been doing a little bit of reading. People have said, I don't even afford enough to be able to buy health insurance on my own, but I'm not that low income where I'm kind of get a subsidiary. So it's almost like they're caught in the middle, or
Yes.
it's what happens to them? They just kind of fall through the cracks.
Yeah, actually what has happened is there's opportunity on one side of this to look at Medicaid, actually become part of Medicaid. So they've increased that by a certain percentage, and that increase is really being absorbed not by the state but by the federal government. The other part is that if you go through the Health Connector and you fall within certain income levels, you could be subsidized federally by the government. So the intention is really to try to get everybody to get health care insurance. Because if I don't and something happens to me, you're essentially going to be paying my bill anyway.
Correct.
So that's that moral hazard we were talking about before. I could potentially disadvantage everybody else if I don't.
Okay. Now, carriers will no longer be rating premiums based on the employee themselves, but also by their enrolled family members and others around them. So talk about that. How will that impact the prices we pay?
Yeah, it's interesting. You know, one of the things that's of a very high interest to insurance companies, and that is like, if you had an insurance company, you would want all the healthy people.
Right.
And you would leave all the sick people to your competitors. But that would be an adverse selection. You know, all of a sudden they get kind of disadvantaged. With this, it kind of opens it up. So everybody's getting kind of an equal distribution of the population, equal distribution to exposure to diseases and illnesses and things like that. So in that case, I think all this will kind of level off when you start to look at it. So it's better to have insurance than not to have it, because it's good for yourself, but it's also good for everybody around you, so to speak.
Which is why you may hear stories about somebody who may be a healthy 21-year-old or 25-year-old or 30-year-old, that they're going to see their premiums go up, but somebody maybe who's older, disabled, or sicker is not going to see that same increase. So some people will see decreases, some people will see increases.
Correct. And you're going to see that balance off after a while. If they're younger and they're paying higher insurance as well, they're going to get older, like all of us, and you'll be able to catch it on the other end. But in essence, when you start to look at that benefit of paying the insurance, it goes into a pool. Just like all of us, we pay car insurance. Even though we don't use it, we prefer not to use it or don't want to use it. But we actually, at the end, it's good to have that just in case something does happen. So for us, I think when you're younger, yes, you're going to be a little bit more angry about the situation. And actually, I wrote down some comments about our doctor of physical therapy students. They said that was a big concern for them. That was a big negative for the Affordable Care Act. And they have a justifiable complaint because they have student loans on top of everything else. And when they're graduating, they're just going to be 26. Next birthday 27, so they can't stay under their parents' plan anymore. So it's like a double whammy for them in the beginning.
And that's probably the most interesting because your students, college students who tend to vote more liberal, tend to be more liberal, are kind of now looking at this Affordable Care Act and kind of not embracing it as warmly as you think that they would, and it's because of their younger age.
Yeah, actually, that's what I found when they just actually had to complete a 4-page paper on looking at 2 pros and 2 cons on the Affordable Care Act. And it was interesting, as they started to explore it, they didn't realize that they didn't know a lot about this Affordable Care Act. So it was great for that as an exercise, even after all these lectures. But the big thing is that they realized how it pertained to them in particular. So some of the major con with them, or the negative part of it, was that they're young and they're healthy and they don't really need health insurance, so to speak. So why should they get it, or why should they have to pay a higher premium with that whole event? But it goes back to what we were talking about before with the concern as a population as a whole. We don't want to have moral hazard really coming into play that often, if we can help it anyway.
Yeah. All right, well, thank you so much, Professor, for coming on board and kind of breaking this all down for us.
Oh yeah, you're welcome.